immunologist in Fairfax, Virginia. I'm the former governor of the Virginia chapter of the American College of Physicians. I've been with Immunize Virginia since its inception in 2020 and was vice chair of the steering committee, and now I'm the chair of the advocacy committee. So, just to introduce Immunize Virginia, a statewide coalition of many stakeholders, which include clinicians, public health professionals, as well as parents and community members. So, it's a broad coalition of stakeholders. We're all united in our commitment to prevent vax. Uh, um, to provide support for vaccines and to uh, prevent disease caused by that can be prevented by
Mhm.
immunizations. We have a variety of work groups, which include advocacy, which I am representing, and provider education, outreach, and communications. Just want to make a shout out to Belle and Rebecca for all the great work that they've done over the years, and for Immunize Virginia. It's been a very trying time in the last 5 years, and it's been accelerated in the last 6 months. And kudos to them for doing just a wonderful job and keeping us all together. Yay. So
Mhm.
next slide, please. Um, so advocacy work groups, what are they? And what do they offer? And they offer a variety of things, as you can see here. Learning and discussion, analysis of specific issues, um, involved in public awareness campaigns. As a newsletter that just came out yesterday, I believe, which was pretty comprehensive, looking at what's been going on in the state, and well worth reading. There was a proclamation that we were able to get, National Immunization Awareness Month proclamation by the new Richmond mayor, Danny Avula, who's a public health professional himself. Um, we During a session in the legislature, which occurs from January through March, we track legislation and look at bills and summaries, and training and skill building, which is what we're here to do today. So. Um, we provide opportunities for direct advocacy and/or lobbying, and part of this talk will be looking at what's the difference between advocacy and lobbying. We are limited uh, to lobby because we get funds from we get government funds, specifically from the Virginia Department of Health. So we don't do direct lobbying, but others can, and we're going to talk about how you can do that. Next slide. Um, Why does it matter? Why does any of this matter? Well, it influences policies and practices. It gets us um, out there, and this issues that are not raised are going to be ignored. So you're So that's part of why advocacy is so important in all locations, whether it be in the legislature or in the community. And hopefully we can build trust within those communities and organizations by speaking out. Next slide. Advocacy 101. So you can't, you want to advocate for specific issues which you feel are most important to people. Okay, so the part of advocacy is finding out what is important to people. And I like this particular line, which issues are easy wins. Politics is the art of the possible. And so you really want to get to an issue that you have a good chance of having success with. You need to find out who's involved in influencing change, who are the legislators who are important to reach out to, and you need to feel comfortable with take with taking on this process. This is something an issue that you feel passionate about, that you want to address. Next slide. Um, Part of this is civic engagement and participating with your community to address social issues and kind of find out what is important in your community. What what are people concerned about, and what can you do to make the situation better legislatively or otherwise? So it's not only, again, not only in the realm of the legislature, but also in the community. Next slide. How can you engage? So there are political activities that obviously voting, which is trying to get people to register to vote is extremely important, and registration drives are very important. Canvassing for candidates, petitioning for particular causes, and lobbying. And the lobbying is done by, for example, the American College of Physicians and the American Association of Pediatrics. They'll have work done on white coats on call days where they go to the legislature and lobby different legislators. The term comes from standing in the lobby to talk to your representatives and or their assistants, and frequently we do stand in the lobby to do that. Of course, there are other activities you could do: volunteering vaccine drives, mentoring people, talking about vaccines and their importance, donating, which is a important individual activity as well. But the one while you can do things individually, it's really important, and there's more success when you work within a group, and certainly that's the case. Almost always the case with a political activity. Um, Unless you're a multi unless you're Elon Musk, you can work as an individual, but most people work as members of a group. Next slide. uh, Civic engagement is important. This is, again, how you get involved. Am I engaging alone or in a group? Other than donations, I really think it's very important to work in a group. And certainly when you're lobbying, they will ask, legislators will ask, who are you representing? Who are you speaking for? Are you a member of are you a constituent? You really, in terms of lobbying, you want to be in a group. Um, is representing more folks. There are a variety of opportunities for volunteering, if we write letters or letter writing, um, even protests and coalition meetings, which we have. So these are all part of the process. Next slide. So what's the difference between advocacy and lobbying? And I think that's an important point that we need to raise here, because Immunize Virginia does not do lobbying. We do advocacy, but it's a little there's not a fine line all the time. So advocacy is supporting, defending, and arguing for a cause. You can say, this is the data on MMR vaccines. This is the data on COVID vaccines, we'd like to you, the representative, be aware of these issues. The asthma, for example, how is it impacting your community? Lobbying is when you specifically uh, come ask the legislator for either to support or not support a particular piece of legislation, and that's something that we in Immunize Virginia cannot do, but others can, like for example, the American College of Physicians can do that. And there's that distinction. So when you're meeting with the legislator, you can even if you're lobbying, you're doing a lot of advocacy work as well. You're educating, and that's important. It's always important to educate your legislator about these sorts of issues, like vaccine issues, which are scientifically based, and they may not understand all the ins and outs. Uh, next next slide. With Bethany had a question: can publicly support certain legislation? No, we cannot. We cannot come out and say we support Bill X, or we're against Bill X. We can tell you what Bill X says, and we can say, you know, this is what's in the bill, and these are the issues. You can kind of glean where Immunize Virginia stands on it, but we can't come out and say we support or not support a particular piece of legislation. That's where there's a blurry line. But lobbying, again, is a type of advocacy, and uh, the again, it's marked for specific legislation, and you want to uh, communicate with the policymaker. There's a whole way of doing that, politely letting the legislator speak, being as helpful to them or their staff as much as possible, because a lot of times you'll be speaking to staff rather than the particular legislator. Next slide. Okay, so can you tell the difference between advocacy and lobbying? Um, a meeting with a representative to educate them about the importance of investing in maternal health. Now, I don't think we have the time to go through this activity, but I think from what I've hopefully been presenting before, I could tell you that this is going to be advocacy and not
Mhm.
lobbying. Next, meeting with the representative to urge them to vote for a bill to provide extra funding. Again, this is a specific bill, so this includes lobbying, and that's something that Immunize Virginia can't do,
Mhm.
but others can. Others can. And as Rebecca says, we can do a lot. We can do a lot of things. We can kind of tell them what piece of legislation can do, what it would and would not do, and so they can glean what we're um, supporting or not supporting. But we can't say please, please. We can't give them a
Mhm.
specific ask. Um,
Mhm.
Next, creating educational materials. Again, advocacy.
Mhm.
Next, preparing materials that include information and contain language for or against. That's advocacy. So that's not specific. Did I get that wrong? Yes. Whew, I got it right. Thank you, Bill. So
Mhm.
again, so that Rebecca mentioned that in the comments, and posting stats about diabetes and stories. And stories, by the way, are very, very helpful when you're advocating and you're lobbying. Personal stories are very, so again, that's advocacy. Um, Thank you, Bill. What? Did I get that wrong? Posting stats
Missed
about
it.
diabetes and stories about, I don't know why that's lobbying, frankly. Can you help me
I
with that?
think I think it might have gotten switched actually when I was transferring the slide from
Oh,
PowerPoint to
okay,
Canva.
because
Some of the fonts has been wonky.
that's definitely advocacy and not
Yeah,
lobbying.
yeah.
Okay,
I apologize.
yeah, no worries. Okay, next slide. Um, Then finally, we'll talk about big P and small p issues, big policy issues that relate to laws, legislation, macro issues, and they could be state issues, they could be federal issues. And remember, when you're lobbying or advocating, who your audience is. So it's if it's in Virginia, you want to relate to things that involve things that legislators can do something about statewide. So, for example, Medicare policy is something that is national and it's difficult to kind of have states um, um, do much about. Medicaid is more of a state, it can be a state issue. And then there's the little p organizational issues, um, policies within your organization. I don't know if everything is political, so I don't know if it's not politicians maybe, but life is political. So working within your organization and leadership opportunities. Next, uh, again, reiterating that uh, big P refers to policy outside of your organization and little p within your organization. And you can always find the little p information within your organization, uh, and certainly get involved in leadership positions with whatever that organization is, whether it's a PTA or um, any other community group or coalition. Find board and get involved board of directors, strategic plans, and get involved with that. Um, and this is the Schoolhouse Rock Finding Big P information, how it's drafted, um, uh, reviewed in committee, vote, and executive approval. What I'd like is the last line that says a rule made by an authority that must be obeyed, and so kind of sort of laws, but we don't have the time, I believe, to go through very much of this. And next slide. The LIS, Virginia Legislative Information System, is wonderful, and I've used it over many years, and it's really terrific. You can look up every bill and resolution, where it's at in committee, whether it went out of committee, what the votes were, and it is just a wonderful place to look at when you go up on the hill or when you advocate or lobby. It'll tell you what's going on in detail, and it's a must. And even if you're not going on the hill, it tells you where things are, and so I think that's very helpful. And then final, go ahead to the next slide, please. Um, and then understand the impact of your policy. And I think this is very important, certainly with the big, beautiful bill that just came through. What are the positive and negative impacts? Any of them unintended? You can certainly review the BBB and look at that. And is the impact temporary? Will it change over time? There are a lot of bills that have all these provisions that where they specify when things start, when things end, and it's good to look at the details. And And that's my last slide. And sorry for going over a little bit, but I think we're good, and I thank you all for listening. You're muted, Bill.
Thank you. Sorry. Thank you so much, Stuart. We really appreciate that. Very helpful. I'm now going to turn it over to Mike Martin, and he will walk us through countering anti-vaccine legislation.
Great. Thank you. If you can go to the next slide. So good morning, everyone. Thanks, and thank you, Bal and ImmunizeVA for inviting me to come. They know that anytime I'm given the opportunity to speak about vaccines, I will 100% show up. And I hope a few of you feel the same passion. That's why you're here. So what qualifies me to make give you this talk? So I'm a general pediatrician for over 20 years now, up in Tyson's Corner. I own a practice called Einstein Pediatrics. We're part of a network called Trusted Doctors, which is 24 practices in the DMV area. Um, I also serve on that executive board and I'm a medical director there as well. My past and then where I really, really got my feet wet in this work and advocacy was through the American Academy of Pediatrics. Um, I was on the board for about 10 years, and I had the great misfortune, I'm not sure, of serving as the president of the chapter in Virginia during COVID. Surprise, surprise. I was handed the reins right as COVID began. Um, and so that was probably my really where I spent the most time working on vaccines and the advocacy role, and getting to know our legislature and process. Um, Side note that I think is really important why, that has helped me in my advocacy is I no longer do this, but I spent over 15 years as a clinical investigator on vaccine studies, which helps, I think, as I navigate and advocate to share stories about how safe vaccines are and how well studied they are and why people should be supporting their use. So next slide, please. Um, so you're all here because you know vaccines work. I don't need to sell you on this idea. We know the data has shown that for a very long time, or vaccines are the way to go. And you would think we wouldn't need to have this meeting at all, that everyone would be on board. I think, unfortunately, people don't make decisions by numbers. And there's a danger in us as we do our advocacy work and lobby too, that we throw too much weight on statistics and moving people to take the actions that we think are in their best interest. So much so that I think a lot of what we're dealing with, folks will actually twist the statistics to make their point, which is always an anomaly. I can't understand how it gets by people. But they'll start with a conclusion and then find a way to make those numbers fit that story. I'll share a story with you. I actually did a very small study where I looked at physician practice, like physicians and what they did with their own kids. This is over 15 years ago, I think I did this, and published it. And unsurprisingly, physicians, particularly physicians who work in the vaccine area, um, vaccinate their kids at very high rates, something like 99%. Like, so if you're a pediatrician, you're an immunologist, infectious disease, people that work with vaccines on an almost daily basis, they're much more likely to have very high vaccine rates. What was interesting is as you moved away from that, and I guess not surprisingly, people like adult cardiologists who don't really do much with vaccines, you saw that rate drop a little bit. Not terrible, 94, 95%. I think the lowest group was like 93, 94%. So, overwhelmingly higher than the general population vaccinating. When you looked at physicians, they clearly were vaccinating their own children. Well, I keep getting pinged, and and I continue to every time someone quotes the study. And I would tell you more people are using that study to show that physicians question vaccines than actually support vaccines, which is just not what what people should come away with that study, what they should take away from that. And that happens a lot. We see this happen a lot. I think we saw it on Capitol Hill when our current director was questioned before he took the role, RFK I'm speaking of, that people can look at the same data and come to very different conclusions, and which sometimes can be puzzling. And so as you have these conversations, it's not a bad idea to use a number here and there, but when you have these conversations, this isn't actually what's going to move people one way or the other. Next slide, please. All right, so why we're here. So we just vaccine save lives. That's clear. And I will tell you, in my job, I vaccinate kids all day long. I tell people all the time. I think most pediatricians will tell you the same thing. Of all the things I do that has the greatest impact on the children I serve, it's vaccines. I do a lot of mental health. I do a lot of other important things. But nothing has had the impact on every patient the way the other things I do have than vaccines. And that's the message we need to disseminate more, that this is life-saving and life-changing. And people don't always see this in their everyday life. But that's where we have to start to help people understand that. We know also why we're here is that public trust and policy are under threat. We took the first item there for granted, and we've fallen into where there's been more questioning of vaccines than ever, and that we're having to work to reestablish trust and build trust with families in an area that again, the numbers you're surprised that we have to do that. The last thing I want to bring up and why we're here, and I hope comes through multiple times, is that I think in a lot of ways we've been reactive to things. We need to be proactive. We need to anticipate. We need to be working now, not when the legislature starts. We need to lay the groundwork and be thinking proactively about how we're going to act and how we're going to have an impact before the crisis hits. Next slide, please. So before I do that, I do think, and I lied a little bit. I'm going to show you, there's a few numbers on here. I think a lot of you may know this, but I do think it's important that as you have conversations, that we correct misinformation that comes up. And a lot of it I hear, even on a daily basis, is a lack of understanding of the safety studies that occur. So I do want to go over this a little very briefly with you. So this is the FDA process, 3 phases of clinical trials. Phase one, which I have to say I only did phase two and three. Phase one is you get about 20 to 100 healthy volunteers. So it's a small group. It's really initially just looking at safety and a little bit of the immune response. But that's really small numbers. So statistically, you're not getting a lot out of that. And so the next phase, you get to hundreds of volunteers. You start to fine tune the dosing, right? So how do we know the right amount to give and how much we should give, whether it's medication or vaccines, actually, and how does the immune system respond to those different doses? And then phase three, and that's actually where I did most of my work. This is the bulk of where we get the data, where we compare vaccinated and unvaccinated groups. We look at their immune responses. We look at safety. And these are often the numbers that you hear quoted when a new vaccine gets approved. Now, going through phase one through three, less than 1 out of 5 studies that start this process for vaccines will actually make it through. So most don't make it. How long does that take? So COVID was very different. But for most of these vaccine trials, this is going to be a 10 to 15 year process with less than 20% making it through. It is the most rigorous of processes, much more than medications, in terms of safety and efficacy studies. I will tell you, going through it, I remember my research coordinator, so one of the processes that happens during this, you often are audited. The company that is like, Merck or GSK or whatever vaccine company it is, they will do their own audits as part of the process, but you also will get audited frequently by the FDA. And those are some of the most stressful audits you will ever see, to the point where my poor research coordinator, when I would come in, I would know when the FDA auditor was there because she would break out in hives from the stress of it. Because of the level of detail they would look at. Every T had to be crossed, every I dotted. They looked at all the data, and some things that probably didn't reflect or change results, but making sure that we were following the process down to every detail. And that would be several days sometimes, depending on how those reviews went. It is a process that's very difficult having gone through it, but really important for families and the people we serve to know that this is being done on every product that comes out. All right, next slide, please. So I gave you a few numbers. I like the less than 20%. I think is nice because I think everyone just thinks that everything gets, pushed through like no big deal. So we have to talk about the landscape because this is the challenge that's happening, and I think it's caught us by surprise. I don't think we can be surprised anymore. Those who are opposing a lot of the mandates and um, recommendations we make are an organized, well-funded, and really savvy group. They've gotten really well organized. They are um, prepared when new bills come up, and they're often the ones speaking with legislators to get some of these bills up that aren't necessarily good for increasing vaccine rates. The number of bills for lack of a better term, anti-vax, that are going to ultimately have the net effect of decreasing vaccine rates are increasing. They're not decreasing. We're seeing more of them in Virginia as well as every state. Um, as background, I think it's important to know we're not in a terrible position in Virginia compared to some states. We do have religious exemption. All that requires um, that yes, so this is related to the vaccine safety. That the process doesn't stop after a vaccine achieves approval. That it continues to be monitored post for those really rare events. So I'll take a step back. This is an important point. So most of these trials, they can be anywhere from 5 to 70,000 participants, depending on the power of the study. But when you're looking at really rare events on these vaccine trials, some things are, if it's 1 in 100,000, right? If it's 1 in 50,000, to be able to detect that, you have to have those numbers, and those trials don't have that. And so the VAERS system and the data link system are ways for us to continue to track the safety of vaccines afterward. And you saw that actually with COVID too. Once COVID got approval, we did find some things occurring at very low rates, but important to know. And so yeah, the safety doesn't stop after the FDA trial; it continues. Um, so thank you for that. Um, Legislative landscape, right? In Virginia, we do have religious exemption. All that requires is a notarized stamp on a parent note. And what's interesting to me, and Stuart says this, I hear him say this as well. There's no major religion. Like I think people take this religious exemption as that's the way it should be. Like why would it? There's actually no major religion that is opposed to vaccines or that has like a statement against vaccines. There's Christian scientists. That's one small group in terms of medical interventions that they do have some positions on that. But all the other major Islam. Catholicism's actually made very pro-vaccine statements in support of vaccines. Um, uh, Judaism the same. Um, it's interesting that this makes it on because it's actually not so much of an issue, but that's where we are in Virginia. And I say this as a practitioner because I know I've seen families use this and it has nothing to do with religion. And actually, I would say I can't think of anyone that I've served that's used it really because their religion opposes it. It's really more of they're using this as a cover for personal exemption. And we'll talk a little bit about that. But in Virginia, we don't have that. We only have religious and medical exemption. And the medical has to come through the medical community. The medical provider has to make that clear that there's a medical exemption. That's not true in all states. So we are lucky in that respect. But here we are. And so we're seeing more bills that are undermining our vaccine systems in terms of getting everyone vaccinated. A lot of these are attacking the religious, are using religious exemption, trying to put it on where it isn't. But they're actually, in many cases, also um, using freedom of choice and distrust to create motivation for some of those as well. Um, there definitely is. Give me 1 second. I'm sorry. They're deciding to mow the lawn while I'm giving this talk, which was bad timing. Sorry about that. So I think the other thing that's really important, this is a vocal minority. They're very loud, but they're very small. That's dominating this conversation. And I think we forget that we are the majority. When you ask people what their position on vaccines is, the majority are in support of this. And I feel like sometimes we act defensively, like we're the ones that are in the minority. And I think that's important to know. That is the landscape. It's just that the majority has been largely silent and not vocal about their position. And I think that's where we really have work to do. And we can't take it for granted. We have to speak out. I'm gonna have the next slide, please. So I wanted to talk about some examples of what's occurring, and some hopefully motivation for us and how we act moving forward. I think many people will probably be familiar of this case study that happened. It was 2014 to 15. There was an outbreak of measles at Disneyland, the most magical place, right? And exposed in California really serious gaps in the vaccine law, because they had at that time both personal, you could just decide personally we don't want to vaccinate our child, as well as religious exemptions. In response, there was a movement to fix that through a bill, and that was Senate Bill 277. Pro-vaccine lawmakers, advocates came together and created a bill to remove non-medical exemptions. So they took a very bold move. It wasn't just personal, but religious. They removed the religious exemptions as well. So a large part of why this outbreak occurred, we know that if vaccine rates fall much below, particularly with measles, before 95%, you're going to see outbreaks. And sure enough, and that's what the data, again, I wasn't going to show much data, but I want you to, as a scientist in you, to see that, is that when that vaccine rate fell, that's what occurred. And just by making this single bill, coverage rose quickly from 91 to 96%. And it was simple but not easy to get done, and it required groups to come together and take a strong position. And this was just a great example of how advocacy made the difference. The bad thing about this, again, it's reactive, not proactive, and that's where I think we really need to change and not let these events happen as much as they are. But nevertheless, I think it's a good example of what can be done fairly quickly to when there is a gap to fix it. I'm going to have the next slide, please. South Dakota recently gives us another example, not so different from our state and what they were seeing in terms of bills. They saw 6 anti-vax bills in 2024. And I think this is where the proactive part comes in, is that because um, you're not always going to know when the bills are going to come up. Sometimes there's surprises to us, like people don't announce, I'm bringing this bill. But once the bills are out there, that's when you sometimes have to mobilize quickly. And they did a really good job of this because, and Stuart mentioned this, bills don't just go straight to the floor, they have to go through committee. And so what they did is they mobilized quickly. They actually had some legislative breakfasts. They organized an advocacy day. They shared stories with legislators. They went to their offices. They actually built a plan. They were strategic in delivering their tactics. And every single one of them, they were able to get basically squashed and voted down in committee. And this is an important point because this is a lot easier to do than once it gets out onto the floor. So taking a proactive stance, it's a smaller number of people that you have to reach. And what's interesting to me is actually, this was actually, they were actually recognized on the floor with standing ovations for having done this, which is not always the case. Often we're met with, and Stuart can speak to this because he's had the experience. Like when we get this stuff kind of voted down, it's often the opposite reception. But I was really proud in South Dakota because they actually gave the advocates a standing ovation, both in the House and Senate, for having accomplished this. Um, and so I think I would put forward to you that as you're doing, and this is lobby work, right? They took positions on bills, so this is getting to Stuart's point. Um, you can certainly educate folks, but this was a group that actually took a position and lobbied and had success in doing that. Next slide, please. So where do we see things going in 2024 and 25? So I think first and foremost, you're going to see these exemptions. They're going to keep coming. They already have in Virginia. They're going to keep coming back. Um, and so it can take a number of forms. So, obviously we have a religious exemption already. We don't have personal. And they like to use the term conscious decision as well as another term, that buzzword that you may see, that they're doing it based on ethical or conscious reasons. Um, and so, and then the other thing you're going to see is what happens during a pandemic when there's emergency powers that the health department has. They may try to remove the ability of the health department to not. So during emergencies, the rules are different, and religious exemption can be removed. Is not part of that. And so if there is actually a crisis, the health department, if things are bad enough, can override that. And so in some states, what they're like in bills, what they're trying to do, they will try to just address what happens, even though it's not happening at the moment, where there is a pandemic, and remove the powers of the health department to take action in those situations. So you have to be careful because it won't feel like it's having any effect right now. But if there is an event that occurs, we need to make sure the health department can take the actions it needs to do to protect the population. So you're going to see more of that. Vaccine discrimination bans. So this often in workplace, and particularly where it's, in health environments, people caring for ill children or elderly, removing their ability to mandate that their staff members be vaccinated is another area that we have to watch for and be proactive about. Um, I will tell you one of the ones that's worrying me that hasn't passed in any states but is coming up. I, as a pediatric practice, have a policy that if you are part of our practice as an independent business, it's not a protected state of not vaccinating. I have a policy that if you don't adhere to the schedule, we have the right to dismiss you from the practice. Um, that's a debate people will have about, is that ethical, not ethical? I will tell you it affects how people vaccinate. And I actually, having done that policy, I know that I'm getting higher vaccine rates from the population doing that. So there's a lot of people on the fence that it will move them off the fence because they want to stay with us. Um, but having said that, there's been a number of bills that have been introduced in some states now where they want to remove or create a protected state that non-vaccinated is a protected state that you can't discriminate against. So that's something we have to watch because that can actually that could actually have tremendous impact on a lot of us in practice, but also in medical work as well, and in medical environments where there's vulnerable patients. Um, Misinformation mandates. That's always like Stuart and I are both docs, so this drives us nuts where the legislator tells us or mandates to us what we need to communicate to our patients, which is often misinformed in the sense that they really don't understand the issues to be able to formulate meaningful mandates on this. And do you really want legislators dictating what happens in that patient provider relationship? So watch for those because some of these, and what it does, and with vaccines, is sometimes they're really hedging the line to make you and how the information is presented to distrust, right? Distrust some of these vaccines, and that's another avenue. I bring up HB 2189 because I had mentioned already that this was one where it was basically sweeping religious exemptions during epidemics so that like if there was an epidemic, that the health department's allowed to override that. And this was going to remove that. It failed, but it's going to come back. That's how these bills work. They'll keep coming back. Even bills that we support that are pro-vaccine often takes a few sessions or few runs to get it through sometimes. And so that's not uncommon. I'm going to have you next slide, please. So we've got to look at the federal environment because this is very much now more than ever going to affect what we do at the state level. Funding's a big one. Medicaid for me is a big one. So people don't always realize, but 49% of children are on Medicaid. So kids that are on Medicaid, kids that are uninsured, and this goes for adults too, that are uninsured or underinsured, often receive their vaccines through the Vaccine for Children program, and through Medicaid. And so if funding's cut, if the rules at the CDC change in terms of what's being recommended, that affects availability of vaccines to those that receive under these programs. Um, it and I will say that often can reflect in what private insurance companies do as well in terms of so if the rules change, if the recommendations change for vaccines, then availability, yeah, companies will still sell the product, but it may not be covered under insurance plans if it's not being recommended. And so that's very clear-cut way that this can affect. But it's also promotion of vaccines. I think someone had just mentioned materials, right, that we use in our offices and in our advocacy to talk about vaccines is being pulled down from the CDC website, but also in programs that are running. And so more and more responsibility of this work is going to have to be borne by the states. And the raw fact is that they don't have the personnel and money to do all of it. And so we're going to have to be, and it's going to be a fight for dollars at the state level and the state budgets that we're going to have to advocate for to make sure dollars are going to be put towards the work that we're doing to promote and ensure that our population is getting vaccinated and is protected. Um, Funding for pandemic readiness and immunization campaigns, I mentioned already, but the pandemic readiness, those are also on the chopping block. And so again, we saw, I have to say in COVID, a lot of stuff fell to the states who weren't necessarily prepared or had the funding. And a lot of it was people like myself and through the AAP and through our practices that were having to do the work to make sure people were getting the care and getting their kids still vaccinated, because the resources weren't there. And so you have to be prepared. And as bills come through, and even in what we promote, and as new bills, we have to look at that. And then I think actually the biggest thing that I'm already seeing in practice is an altered public perception of vaccines and more people pushing back on the vaccine schedule and getting vaccines, even in my practice where we have a policy. That's taking me by surprise. And so I'm always like, in primary care, Stuart and I are a little bit of the canary in the coal mine. Happened during COVID. We'd be like telling the health department, no, we're seeing an uptick. And they're like, oh, the data's not showing it. And a few weeks later, it would show it. Um, so I have to warn you, that is happening. Like even in an area that's high, like I would tell you in Northern Virginia, during COVID, we had much higher vaccine rates than other areas. We're a pretty pro-vaccine area with higher vaccine rates. And even here, I'm seeing it more than I've ever seen it in the 20 years I've been here. So we have work to do, not just about legislative bills, but in reaching out to our communities locally and making sure that the right messaging's there. Okay, next slide. All right, so I've hit on this, but I just want to make sure I hit it home. What to expect in Virginia? You're going to see exemption bills. That's coming, so prepare for it. You are going to see a lot of this being tied to parental rights, and that appeals to some legislators, and you're going to have to be mindful of that in speaking with them and how you, if you do reach out to them, how promoting and mandating vaccines is not a parent rights issue. It's a safety issue and it's a public health issue. So we have to reframe some of this, and that's challenging. You're going to see And I put HPV, we've actually made some strides in improving HPV rates, but we're seeing some attacks on that in other states. So I'd watch for that. COVID requirements continues to be put in, which is interesting with COVID vaccines, particularly in health environments and certain environments where people have mandated it. And so watch for those. But again, you're not going to know everything's coming. But I will tell you the other way to figure out what's coming, look what's happened in other states. Because I told you the anti-vax group is much more organized and they're working together across states. They're nationally organized. And so what they're trying to find is the holes at the state level where they can begin a movement and that will spread. And you see it. I will tell you as an advocate and working with a lobbyist, we do the same thing. It is very persuasive if I know that every state around us is doing something that I take to legislator, we should do this. It works the other way too. And so as they can build that momentum, they're going to use that when they're coming up with bills at our state. So you can get a sense, and I'm going to tell you, ChatGPT, I'm sorry, not to promote any product, any AI, like because these bills, most states have what we do in Virginia, and they're listing them on websites. You can actually do that work through AI too. It will pull some of that, sometimes a quick way. Then you go to the sites and you can look because we have to be really smart. There's 50 states. It's a lot of bills to look at. Organizations like ImmunizeVA can be really helpful and have the resources to do that. The AAP does that. But I would encourage you to look. That's a place to look to see what's coming and get ideas and see what other states are doing. So that's, talking to advocates for vaccines in other states and other health departments. Next slide. I'm going to keep hammering this. So we know, knowing is not enough. We must apply. Willing is not enough. We must do. And so that's going to be my next part here is like, you need to come out of this talk. There's at least a couple things you can do in the next couple weeks. And as individuals, you don't need to do it at an organizational level. So next slide. And now's the time. Like, don't wait till legislators in session. We got to be move from a reactive to a proactive. So with legislators, they're people. And as much as it actually somewhat bothers me, I wish they just looked at the data and what's best for the population and listened to those of you in public health that do this work and are advising them. They are moved by relationships. Their trust comes from, it's just human, right? So you all have a representative, you all have a senator, develop a relationship with them now. Ask them what their positions are on this stuff. Let them know this is important to you. That can be in person at their office. They usually will have local offices. They will hold town halls. Go to town halls. Ask the question, where's your position on this? Make yourself a resource. Some of them, if they are aligned with your values for pro-vaccine, offer to be a partner in that. Don't wait to do that. Do that now. And it can be emails, it can be everything, phone calls. Build a relationship now. I will tell you, it somewhat surprised me. It doesn't totally surprise me how influential that has been in success that we've had at the AAP level. I will tell you, these relationships start locally. I did a lot of work during COVID with the Fairfax County School Board, and that allowed me to build a relationship with someone who later became a senator. It's because they knew to trust me. They knew where I stood on things, but they also knew I would show up when they needed someone to show up and speak out in favor of these things. The second thing I would say, stats, again, important, but unfortunately, it's just human nature. Stories are the things that stick with people and people remember. Um, and so have your stories, make them personal. Don't try not to use other people's stories. It really needs to come from the heart and it needs to come from your experience. And be who you are. I think a lot of times people get really nervous and they try to prepare all this stuff. Be yourself, be authentic. I'm gonna tell you the other place to share stories and do this stuff, and I'm gonna go a little bit of a tangent, is we all have family members, we all have coworkers, and you're like, wow, I really try not to mix my politics. This isn't politics. This is about people's health. And I think we have to stop treading lightly on this. I'm not talking about being confrontational, but you can let people know in your feeds that this is important to you. This is of value to you. Because a lot of these people are looking up to you and you may be a mentor to them. They may value your opinion on other things. Why wouldn't they value your opinion on this? I would I know it's going to seep into your private life, but I will tell you, this is where we are. There's a lot of influencers, blah, 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 but people are making decisions by what they're hearing around them in their community and in their social network. And you're part of that. Um, I would think about that as another avenue of advocacy that you can do. It doesn't have to be confrontational. They can ignore it. They don't have to. But I think for a lot of us, we've been afraid to enter that. We're trying to keep our world separate. It's a powerful area, and think about if that's something you would feel comfortable with. And then as we speak with people, whether it's that micro level or you're speaking with legislators, be respectful, be informed, be persistent, keep coming back, keep showing up, go to those town halls when there's events, as much as possible, be present. Don't be confrontational. They may take a different view. They may be like, nope, I'm parents' rights. I'm going to put this exemption in. Um, that doesn't have to, your conversation doesn't stop there. You can keep revisiting them, keep informing them, keep educating them. Okay, next slide, please. All right, so here's your action steps. I just told you the first one already. Contact your legislature. You should be building that relationship now. You should be asking questions now. As the legislature gets in session, testify at hearings. You don't have to speak on behalf of a group, and that's important. That's what we're talking about with Immunize VA. You're not going to be able to lobby, promote a particular bill, or be against a bill on behalf of ImmunizeVA. You're going to have to speak as an individual, or if your organization allows you to lobby, and it's important to mention that. Legislators want to know if you're a constituent or not. Let them know that. So where are you located? Why is this issue important to you? But as these things hit the committees and subcommittees, anybody can sign up to testify, and tell that short story of why this is important to you and your neighbors. Attend locally. There's going to be community forums, school board. I can't believe my son went to, he's very much interested in urban development, and they just had a hearing about building a lane for buses on Gallows, I think it was. I would think it's going to be the most boring meeting ever, but I'm really proud of him because he's showing up. That's what we have to do. We can't fill the room, let the room fill with the very loud minority. The silent majority has to become loud. And so we have to show up. Um, Time doesn't always allot that. Writing op-eds, letters to the editor. This is useful, particularly as issues come up, as things are happening at the federal level and it's on people's minds. Send in a letter. ImmunizeVA can help you with that. Their staff are wonderful. I'll tell you that if you're interested in writing about vaccines, we work with parents all the time, and help support them in helping us promote. You're not alone in this, and it's like the first time you're doing it, it seems intimidating. It's not that tough. It's really just putting in a certain format and knowing a couple rules, and we can help you with that. And then advocacy days, I mentioned South Dakota had it, and we do that with the AAP, and a lot of the medical organizations do this. We come together, we invite legislators sometimes to come to our group, and then we go up to the Capitol and actually go to their offices and speak with them and their aides. And then to the point where they know us now. And that's what you want. You want to be recognized as a group or a person that's showing up. They're much more likely to work with you, and they may reach out to you. That starts to happen when you build that relationship. Okay, next slide. Almost done here. I do want to give kudos to South Dakota, Immunize South Dakota, and South Dakota for vaccines. They have some wonderful toolkits. I know ImmunizeVA has some stuff as well. The Academy of Pediatrics has some stuff as well. Um, you can reach out. I think ImmunizeVA is a great place to start because they're connected with all of our organizations. If you're looking for things, start there. Um, Again, I'm going to stress build your story. They can help you with that as well. Why is this important to you? And have stories to reflect that. And again, coordinate your messaging with the SBA. Next slide. So your action starts now, guys. You got to stay informed, start looking at bills with others. We can certainly, hopefully, Immunize VA, we can start doing it. Like we can push that information out to you. But where we can't do is the personal stuff. That's for you. Start doing that now. Get your list of people that you need to make contact with and do it. Um, then you got to be ready to be once the legislature's in session, because this stuff happens really fast. And so the more of you we have, and I can tell you, even as it's very hard for us, we are always looking for parents. So if you like have friend groups and things, people that do this, we need that. We need, and then if you have a group of people, usually you can get at least one or two people to be able to go down and actually speak at these sessions and testify. Um, because at the end of the day, this can't rest on a small number of people. We have to move from being the silent majority. We have to be a loud majority, because we are headed in not a great direction. Vaccine rates are coming down. We're seeing more people question and distrust, but we have science on our side and we have the majority on our side. And so now is the time, though, and we have to be doing this work. Next slide. And I told Bella, I'm a pediatrician, so I have to throw a pediatric slide on here. Um, I know it feels like a hill sometimes with this stuff, and it's scary sometimes going in front of these groups, and particularly when the anti-vax folks are there. But we have to support each other. We can't be afraid anymore to speak. We have to take an active role in this, and everyone here at Immunize VA and AAP, we're here to support you in this work. Um, and however much time you can donate, if it's 30 minutes a month, if it's more, well, every minute counts. Don't underestimate the importance of that. And think about the things you do day to day that you could add just a little bit to it to promote vaccines, because this is happening in communities, in neighborhoods, these conversations. We can't just stand by and like, I don't want to, it's too controversial. I can't talk about this. We kind of have to now because it's headed in a direction that's going to affect all of us. What's happening at the federal level is going to trickle down. What's going to happen to the states. Our access to these things at an individual level is going to be affected. And so now's the time to act. It's not later when things get worse. It's now. And I want to thank you all for letting me speak. I hope this was helpful, and I appreciate all of you because I know you're all actually working in your own avenues in your different lanes. And it's time our lanes merge and we work together on this. So thank you for all you do.
Great. Thank you so much, Mike, and thank you so much, Stuart, for both of your presentations. They've been extremely helpful and motivating, so really appreciate it. We're going to take a 5-minute break, and then at 12:15, we will get started with our training from Lindsay on how to write a letter to the editor uh, or an op-ed. So I will see you all in 5 minutes, and I will leave up Thomas the Train as inspiration until then. Hey everyone. We're gonna come back and get started with our training from Lindsay. Lindsay, I think you should be able to share your screen.
Oops. All right. Yes, unmuting too. So let's see. That work?
Mm-hmm.
Perfect. Am I good to go ahead and get started?
Yep. Thanks so much.
Sounds good. Thank you. Hi, everyone. My name is Lindsay Cobb. I work with the Shot at Life campaign of the United Nations Foundation. We are a grassroots advocacy campaign that trains volunteers across the U.S. to speak to their members of Congress about global immunization issues. But I think a lot of the resources that we provide, including training on writing letters to the editor, can be applied to domestic health issues, to anything else that you care about, really. So while we're using a lot of global immunization examples in this training, I think hopefully you can take some of it away, whether you want to write a letter to the editor about global immunization or about immunization in Virginia or anything else that you care about. Um, and before I get into that, I just have a few background slides on what Shot at Life is. And of course, if you are interested in getting more involved in our campaign and our global immunization work, we would always welcome that. I think there's a lot of great crossover between people working on the domestic, local issues, and then also our advocates on the global side as well. So make sure that you have my contact going forward. So to dive right into what Shot at Life is, we are a grassroots campaign that makes sure that children around the world have access to vaccines and a shot at a healthy life. And we, in particular, focus on routine childhood diseases, especially pneumonia and rotavirus, but then also we talk a lot about polio and measles just because we can get rid of these within our lifetimes. We have the really effective vaccines. And then we also talk more broadly about strengthening healthcare systems because we know that you can't just immunize a child, but you also have to think about the broader healthcare as well. So we have three main aspects of our work here. We do education, a wonderful comms team who promotes accurate vaccine information from our partners. We do advocacy, which we focus so much on, especially at the federal level here in the US because of how much money the US government has, and we hope will continue to invest in global immunization. And we also partner with corporate partners and donors to give grants directly to the partners on the ground who are actually doing this work. So we are focused on the fact of a lack of access and that 1.5 million children still die of vaccine preventable diseases every single year, and mostly in low and middle income countries. And we are focused, like I said, a lot on pneumonia and diarrhea because we do have the pneumococcal and rotavirus vaccines, which can prevent some of those cases. But we know that there are a lot of different reasons why children aren't vaccinated, but that a lot of those can be addressed if there's the funding and the will from the global community to come together. But we do know the solution is all about access, and access to vaccines has grown significantly over the last few decades, although we are seeing some stagnation now, somewhat related to the COVID pandemic, but then also other issues. We've seen increased displacement and conflict, and now this major issue, not only in the US, but in many other donor countries, of a donor retreat from not only global health, but broader development. And so a lot of the work we do is to address that. But we do know that vaccines save over 4 million lives every single year, which is a child's life every 8 seconds. And we like to, and you all probably know this better than anyone that working in the local vaccine space is that prevention is hard to see, and vaccines can almost be a victim of their own success. And we don't see the diseases that aren't there until the cases come back and things like measles outbreaks that we're seeing around the country right now. But we do know that there has been really incredible progress made just over the last few decades, in particular for children under 5, that top green line, and that deaths have dropped in half since 1990. And so it's really incredible progress, but it is also progress we have to protect. It is not a given as more children are born year after year. And it's also still millions of children dying from preventable causes. And so this is really where our partners do step in to help. Shot at Life does not directly administer vaccines. Instead, we want to make sure that our partners that you see on the screen here have the funding that they need. So the multilateral organizations at the top, WHO, UNICEF, and Gavi, the Vaccine Alliance. And if anyone's been following this space, it's kind of been a back and forth between the administration and Congress on, you know, will the US continue to fund any of these multilateral organizations? Will we pull out of the World Health Organization in January when that timer is up? Will we put money into Gavi, the Vaccine Alliance, given some recent announcements by HHS? So there's a lot of questions there. And I'd say even more questions on the bottom too. So the US government has historically played a really large role bilaterally in global health as well, through the CDC and US Agency for International Development's global health and immunization work. We know that a lot of that is shifting right now, with USAID in particular having been dissolved and merged into the State Department. Unclear what the programs that were formerly housed by USAID when it comes to immunization will look like. But we do know that those capabilities are critical, and those capabilities directly support the work of the multilaterals you see at the top of the screen. And so we are still advocating strongly for those capabilities, whether it is within USAID, in the State Department, still advocating for the CDC's global health work. So it's a complicated time, but I think, as the other presenters summed up really well too, this is a moment for us to have these conversations. We're both being reactive to that, but also proactive for what might happen next and how we can still support these capabilities, even if it looks different than what we were directly advocating for in the past. So this is what, at the end of the day, these are the programs that we help our advocates around the country support. And at the end of we are talking about a very, very small amount of money, relatively, of course. Americans on average think about 30% of our national budget goes towards foreign affairs or international affairs. It's in fact between 1% to 2%. And of that, only 20% goes towards global health. Especially for first-time advocates, a lot of our advocates aren't from healthcare backgrounds. They don't know a lot about either healthcare here in the US or globally. And so just to put it into a little bit of perspective, that we are only talking about this fraction of the federal budget. And we can break that 20% in global health down even further into global immunization or other programs. But it is still hundreds of millions of dollars that has a really outsized impact. And since we are advocating at the federal level, these are the subcommittees that we focus on. So you can see those light blue boxes. But we just encourage people to reach out to their members of Congress no matter what, because they do work for you. As you're the constituents, you vote them into office, you pay their salaries, and so they should know what you care about, whether that is domestic, local level issues, or the broader global ones. So this is the framework that we advocate within. And we do both advocacy and fundraising, but focus so much on advocacy because, like I mentioned, it is hundreds of millions of dollars. In fiscal year 24, Shot at Life helped protect $615 million in the federal budget that went towards global immunization programs. And here are just a couple examples of what we ask our advocates to do throughout the year, whether that's emails, social media posts, phone calls, getting published, meeting with their congressional offices, and we'll go into this about getting published in newspapers and newsletters in a moment. But I do want to say, if anyone in this group is interested in learning more about Shot at Life, how to get involved, you can definitely reach out to me and I can connect you with some more of our resources. Make sure you're on our email list. So if any of this other stuff piques your interest specifically on the global immunization side, please feel free to reach out. Or we also do one-off trainings for other organizations as well, if there's a group you work with that might be interested in doing a global immunization training. So with all that, I wanted to dive a little more into the getting published. Two major times of year when we specifically work with our advocates to get published, in the spring when the budget season is kicking off and really encouraging lawmakers to prioritize this, and then again in the fall when they're supposed to be wrapping up the budgets. And so we provide a lot of resources, work one-on-one with advocates to help them get published in their local newspapers and newsletters. So we focus a lot on letters to the editor, but also recognizing that there are some newspapers that just don't accept opinion pieces. If there are other ways, like a newsletter, whether that's on a campus or an organization, just any way to get the message out there and to really call people's attention to these issues. So, why is getting published so important? You can reach a really targeted audience depending on who you want to reach with your message. And especially because you can share it on your own social media channels, you can share it with your members of Congress, especially if you call them out. Not only will someone in their office likely see that if their name is mentioned in a publication, but you can also bring it and say, to a congressional meeting or bring it up in a phone call to call their attention to it. And it might not be something that's covered in a news article. On the global immunization side, we are seeing more recently when it comes to just regular newspapers talking about global health. This has not always been the case, but it's a great way to bring your perspective, and I think in this case, really your expertise when we're talking about issues like global vaccines or global health. All right. So 4 steps, and we'll go through each of these. You need to research, you need to write, submit, and then share. So we'll go through each of these for a moment, but I think this really is a very basic framework, and especially if you've written one before, you probably know these steps. But that can be applied, again, to so many different issues that you care about. All right, number 1 is to research. Really think through who you want to reach with this message. What are your local publications? What newsletters might you have access to? It doesn't always have to be the one with the largest circulation. Maybe you're targeting one member of Congress in a very small congressional district, just a newspaper that they might read or that they might find important. Or if your broader goal is to get more people involved with these issues, think through how you can reach them. Then you have to even find out if they accept letters to the editor opinion pieces. They don't always, or it might be buried really far into their websites. Sometimes it's right at the top. It says opinion. You can click that and it gives you really clear instructions to submit. That's not always the case. You might have to dig around, find the email of their editor. There might not be clear instructions, so you might have to ask. And in our case, if you want to write a letter with Shot at Life, or I know ImmunizeVA also has great resources just to reach out and we can help you as well. Just looking to see what they've even published in the past, since that can give you a great jumping off point if they do have something about vaccines, if they have something about the latest measles outbreak. And then again, don't forget about other ways to reach people like your school, community, or organization's newsletters, especially if that is your target audience. We've seen people with great success get published, and there's the National Association of Pediatric Nurse Practitioners has a newsletter. We've seen people get published there or any other organizations that they're members of. Then you're going to write. These are the few tips we tell people to keep in mind. Of course, is 1, make it personal. Not only why is this issue important, but why is it important to you? Those stories are never going to go stale. If the headline moves on the next day and your hook isn't your personal story, that could not be important the next day. But telling your story and what your connections are really the most important. But you do want to make it timely and why this is important now. That is why it can be great if you find a recent piece that they published on something that you can respond to that makes it really timely. Or just, bring in other sources to show reporting on these issues, even if this newspaper itself hasn't reported on it. You want to make it relevant, make it matter to your congressional office, make it matter to your community. I think the measles outbreaks have unfortunately been a way to tie these global health issues back into local, when you can talk about measles cases that are happening in your state, and how this should matter to your member of Congress. Maybe your member of Congress has a military background and you can tie in protecting our service members overseas, global health security. And so I think there's a lot of ways to do that. And then finally, you do want to be really direct. Make your ask, whatever that is. End with a clear call to action. Usually, if it is something targeted at members of Congress, which most of our opinion pieces are, directly put their name in there, then they'll see it. But tell them what you want them to do, especially if you're speaking in as an individual. I know the lobbying versus advocacy can get a little trickier, but if you are speaking up as an individual, what do you want that member of Congress to do? Support this, don't support that, vote against the rescissions package, whatever it might be, end with that clear call to action. But you can also, in some cases, if there isn't the clear call to action, make it a general ask so then it can be evergreen. Maybe they can't publish it this week when they're focusing on one specific bill in Congress, but if you just say protect global immunization programs, that can be a way to also make it more relevant in the future. And there are a lot of different angles that you can take. These change, I think, depending on the time of year. There's like international recognition days like World Polio Day or World Immunization Week that people can tie it into. But again, this can really depend on your personal story and what angle you want to take with an opinion piece. And we do have a lot of examples of our volunteers who've gotten published in the past on our website. And I can also share these if anyone is interested in seeing more of them. And here's just a few screenshots from the past few years. Beyond telling your story, you do want to incorporate statistics. So I just pulled a few. Some around World Polio Day, people will pull in statistics about polio, but then also maybe make the connection. We do have volunteers who either suffered from polio themselves, know people who did, and so pulling in the stats to supplement the stories is really important. We talk a lot about Gavi, the Vaccine Alliance, and how their incredible work over the past 2 decades, and that how countries actually graduate from their support and are financing their own immunization programs. And then again, you can tie it if you have stats about the measles outbreaks. We're still waiting to see what exactly the 2024 numbers look like for immunization, but we do know specific numbers for outbreaks in different states, and so you can pull those in as well. And just an example of another polio piece that was published. And then you want, of course, to submit. If sometimes it'll be an online form on the website that you'll submit through. Again, follow those instructions really carefully if they have a certain word count or if they need certain information in that submission. Sometimes you'll just find the editor's email, and so you want to make sure it's really clear what you're emailing them about, and just keeping the message of your body short and copying your full letter in there. You can follow up, especially if you're emailing the editor, they might have just missed it in their inbox. So if you haven't heard back within a week to 10 days, we usually encourage people to send one follow-up email. They don't always tell you that you're going to be published. So just if you Google your name once every couple of days after you've submitted to see if it makes its way into the paper. And we usually encourage people to only submit to one newspaper at a time, because usually they'll do a reference to see if this piece has already been published, and they won't. If it has been published in another newspaper, then the other one won't want to do it. So just submit to one at a time, and then if you don't receive a response and you followed up, then you can move on and submit that to another paper. And then, like I said, keep an eye out for it. They don't always notify you, so be sure to check yourself as well. And then really amplify it. I think this is how you can really build on the impact of submitting a letter to the editor, especially if it's not in a publication with a huge audience. Share it on social media. If it is a letter to the editor about global immunization, share it with us and we can amplify on our channels. And then keep copies of it, print some and bring, if you have an in-person congressional meeting, if you have a relationship with certain staffers in congressional offices, you can always share it with them. And so kind of keep the record of that for the future, even if you're not immediately going to flag it for your congressional office. And then, of course, we always like to see when our advocates share them, and I'm sure that Immunize Virginia would as well. Okay, so that's really it. Pretty basic steps on writing a letter to the editor. I will say we love working with people and helping them brainstorm, draft letters, edit if they just need someone to glance it over before they submit. So you could always reach out to Shot at Life if you are interested in writing an opinion piece for global immunization. That's our general campaign inbox, champions@shotatlife.org. If you're interested more broadly in getting involved with some of our advocacy, feel free to reach out as well, and we can provide a link to one of our advocacy trainings. And then you can also take action and subscribe to get our email updates if you fill out one of our petitions, shotatlife.org/petition. And that is it. So thank you so much. I'm happy to be a resource, and I will put my email in the chat as well.
Great. Thank you so much, Lindsay. That was really helpful. So I am going to share my screen one more time and talk through a couple of ways that we can apply these suggestions from all three speakers into our work with ImmunizeVA. So, one moment. We're back to Thomas. um, I wanted to highlight that tomorrow we have our monthly advocacy work group meeting from 3 to 4 p.m. And so this is a great opportunity if you've, after attending today, decided you want to learn a little bit more about the details of what goes on with the advocacy work group. We'll be discussing the National Immunization Awareness Month proclamation that was submitted to the mayor of Richmond and approved. So we're going to be planning some outreach events to highlight that proclamation. We'll also be talking about how we can uh, mobilize ahead of the General Assembly session, which begins in January. So how can we start to develop those um, meaningful relationships with legislators? We have a few so far, but always looking for more relationships. And then also, in terms of, there's a poll that I'm going to launch right now. Uh, Bear with me. Here we go. So this, I just wanted to gauge everyone who is on the call, whether you could see yourself continuing advocacy work with Immunize Virginia moving forward and what form you could envision it taking. So some of the suggestions are that you would join us for a day of action at the General Assembly in Richmond next year. Um, you could publish a letter to the editor. I wanted to give also a shout out to Bethany Hammond, who was on this call earlier. She wrote a really great op-ed for us last year for National Immunization Awareness Month, which is always a time of year where we try to do a big push for outreach. And that's August, I should specify. Um, and then we also have our Vaccine Save Lives t-shirt fundraiser. So could you envision yourself wearing one of these? Um, or if you have a new idea that the group has not already thought of, we are always looking for new perspectives, and we would definitely be open to any creative ideas you have. So I'm seeing a lot of interest in a day of action at the General Assembly. That's really great to hear. Interest in publishing a letter to the editor as well. Um, Great. Well, I will put my information in the chat and then also send it out via email so that if these are next steps that you would like to take, please feel free to email me and I can help to get the ball rolling. Specifically with a letter to the editor, if this is your first time writing something like that, Rebecca and I are happy to help you with drafting the first go at it. We're also happy to publish it in our newsletter if it feels a bit too daunting to do the letter to the editor in a regional or local newspaper. So there are plenty of different avenues depending on your comfort level. And I will also include information about the meeting tomorrow and the Zoom link so that you can join that. All right, well, thank you all so much. Since we have a little bit of time left over, is it all right with the three speakers if we open up the floor for Q&A? Okay.
Um, Just wanted to, this was mentioned in the main chat, and I'm really interested in this and getting your views on this. Is that the state of Maryland had in June the voted to maintain the CDC schedule of vaccines as it was in December of 2024. And I've been I talked to Delegate Hope from Arlington, and he says, and I haven't investigated this any further, he says that Virginia can do similar legislation in terms of vaccine recommendations. I don't know, Mike, whether you know about that, or I think it's kind of cool to try to do that. So you're muted, muted. Mike?
Oh, I don't think he's muted. I think we just
Can you
can't.
hear me?
Oh,
Yeah.
yeah, now we
Oh,
can.
okay, sorry. It's my mic itself was it's
Oh,
weird. You touch it, it does. So, yeah, this is super. I've been thinking about this because I was really proud of this bill a while ago that we had that essentially takes out the need for every new change to the schedule to go through the legislature because that's always been a barrier, right?
right,
The legislators hate having to do like it, and it's you've got to go through the whole process every time a change is made. So we have a bill that's already, well, now it's law, that if as the schedule changes, it automatically becomes the requirement for schools. We don't have to take it to the legislature,
right,
right?
right,
Well, now what happens, right?
right,
If that drastically changes. And
right,
so I think we need to strategize that. And so I do think that's a way around it. The problem with it, right, is if you sort of freeze it, well, you're going to have to come back at some point because there's going to be changes to the schedule in the
right,
future. So
right.
it's a short-term solution. It's not terrible. I'm like, that might be better. So yeah, no, I that is something very much on my mind.
I mean, I'd have to look at what exactly Maryland said, but I mean, I think the only thing ASIP did differently was get rid of thimerosal, and which is ridiculous, but
Right.
they're
Yeah, they haven't changed the schedule dramatically yet, but they're definitely positioning to potentially do that.
the aluminum, is the next one, and that's going to be a lot.
That's going
That's
to
going to
hit
affect a
us.
lot of vaccines. So anyway, I think we'll have to wait until after November, right? I mean, and hope for different a governor who will be willing to sign this legislation, right? And maybe and a House of Delegates that would be willing to pass something like this. So, but I think that's something that's really important. I think just in terms of strategy now to we're now I like the way you got alluded to Nixon with the silent majority. I think we're also states' rights now is another thing that we can we can use as a way of working around what's going on in the federal government right now.
And I love that you're engaging the legislators now because I don't think it's on the radar. Like I just with this stuff, they don't know it, so they're not prepared. They're not going to be prepared for it. So even though I don't have a definitive plan, I'm like, this is something I've been talking to folks about. What should we do? I think again, reach out to your legislators. In our area, they're generally very pro-vaccine. Put it on the radar
Right.
because it's coming. Like there's a good possibility that the landscape's going to look different in terms of the recommendations.
Oh yeah.
And, and I know for our practice, like we've used the CDC and the AP's done this, that we're coming out with, hey, we do our own schedule with experts and things. We will continue to do that. We're starting to position, and for my practice, the same for our policy. We're changing the wording on the policy to reflect AAP.
Yeah,
Normally it's been
the
so
problem is
normally it's been, that's been the same.
the problem
Um,
is the insurance companies, I mean, and they, I mean, uh, the Medicare has to accept ACIP recommendations. Doesn't
so
have to,
that's the problem with the federal stuff, right? And the funds and how that works. That's not going to fit. Yeah, 100%.
yeah. So that's going to be a problem. Anyway, just wanted to raise that. I think we need to kind of and we are, of course, brainstorming about how to work around um the kind of what's coming down the line.
Yeah, and Mike, I wanted to ask, so I'm looking at the LIS website right now,
Mhm.
and do you remember, was it Senate Bill number 1117 that harmonized the Virginia school requirements with CDC?
Oh, and no, I
It's
don't
okay
remember.
if you don't remember. I was just going to link it for
I'm not that
everyone,
good
but
with
I
those
I want to make
numbers.
sure I'm linking the correct thing.
It
Um,
may be. I can look it up, but yeah.
okay. Yeah,
I
well,
was so proud of that. I was so proud of that bill, and I'm like, oh my gosh, if that bill is going to become a
yeah, I mean, never in a million years, I think, did anyone
nope.
anticipate that ASIP would not be the science that we
Yeah.
follow. Yeah, and I know that this is something that VDH has, they've been mulling over as well. So I think it will be something that potentially we could take some action on next year.
Yeah, I mean, and I think we need to work on saying whether does Virginia have the right to have its own vaccine recommendations, and do insurance companies? I mean, the
Yep.
Maryland law says that the insurance companies have the obligation to accept those recommendations.
Hmm.
It's an interesting law, and I see that Bell. It was in our newsletter, and it's a good model. Of course, Maryland's a very blue state, so oh,
Yeah, well, I'll add to the meeting agenda for tomorrow, that we could maybe take a deeper dive and look at the
yeah,
rest of that bill.
good, good.
Great. All right. Well, are there any other questions from the group? If not, I will end this webinar a bit early. But thank you all so much for tuning in today. I think this has been really fruitful conversation, and it's great to know that there are so many people who are passionate about this topic and looking to get involved. So I will be sending you all an email with steps to take if you'd like to get further involved with Immunize Virginia. And thank you so much again to our speakers.
Thank you.
Thank
Enjoyable.
you.
Great. Thanks so much.
Thank you.